Hey guys, welcome to the next video of the Unbroken Pelvis channel. Again, my name's Keith and I'm glad you could watch. So today I just kind of wanted to tell you a little bit about my story and kind of how things affected me as far as my pelvic floor dysfunction, what my symptoms were, and my road to recovery. But first, I think it's a little important to talk about the history that I have, medical history. So I've always kind of struggled with injuries. Ever since I was a kid, I would subluxate my shoulders or my elbows or my knees would go out. And I didn't realize this until kind of halfway through my journey, but apparently I'm hypermobile. And it's not uncommon that folks that deal with pelvic floor dysfunction have some sort of hypermobility. It's not everybody, but there are definitely some who are hypermobile that are more predisposed towards pelvic floor dysfunction. So that's something to keep in mind if you are a hypermobile person and you're dealing with pelvic floor dysfunction. That is something that can make your symptoms worse or make treatment a little bit more challenging and make you more likely to deal with nerve compression and pelvic instability. I'll get into that a little bit later. But another thing about me is I also have some trauma to my tailbone called the coccyx. And when I was a kid, it's old trauma. When I was a kid, I was 14 years old. I fell about 14 feet from a tree and landed flat on my tuchus, and I actually dislocated it. And so instead of the coccyx being in this position, it's kind of in that position and over to the right. Now, I was asymptomatic before my pelvic floor dysfunction hit, but I do have a history of having some difficulty and pain when sitting. Although when the pelvic floor dysfunction hit, it was not even close to the type of pain that I had, kind of in a different area. But I do think that the prior trauma to my tailbone played a role, not a direct role, but a supporting role into my pelvic instability. And then the other thing is I have a history of sitting a lot. Ever since I was, of working age, I had a job where I was either in a call center or, doing something where I was sitting for multiple hours a day. I'd wake up, I would drive a long way to, commuting to work, and, usually like an hour to an hour and a half, depending on the job and the location. And the job would involve sitting in an office chair, in a cubicle, in a call center type of environment where I was sitting for 8, 10, 12 hours a day, especially once I got into management, working in various insurance facilities. I would be managing a team and I'd be working 12, 13, 14 hours a day just to keep up with the demand at work. A lot of you know what that's like, having to sit a long time. Then, of course, I'd drive an hour home or more, depending on traffic, and I'd be sitting, on the couch as soon as I got home after eating dinner, and I'd sit until the rest of the night. Wasn't very active. I've never been an athlete or into physical fitness as much. Every time I would try, because of my hypermobility, I would injure myself and then just kind of give up. So knowing that, I had seasons where I had some pain when sitting related to my coccydynia or my tailbone pain, but never anything like this, never had any symptoms like this. So let's go back to when this all started. It was October 24th, 2021. And I'll remember that day for the rest of my life because it was an extraordinary day. We had just finished a road trip, a family road trip from Dallas to Galveston area. It's about 4.5, 5 hours. I had drove down on Friday, and I had noticed that throughout the trip, I was kind of shifting in my seat a lot, just uncomfortable. I had this strange sensation, almost like tension. It wasn't tailbone pain, but I had learned to sit to kind of avoid direct pressure on my tailbone, especially when driving or sitting for a long time. And so I found myself having limited options as far as positioning in the seat. And I was just shifting from left to right and front to back, trying to keep pressure off the tailbone, but also trying to not make this phantom pain any worse. And so, I started to, on the way back, I started to have these very strange sensations, like this shooting sensation, and I felt like I had to go both number 1 and number 2 at the same time, even though I had went just a few hours earlier. Very unusual for me. And so finally I got to a point, we were about maybe an hour and a half outside of town, and I was just in agony, almost excruciating pain, and I told the wife I need to pull over. I pulled over into a Sonic and I tried to use the restroom. And that's when I knew something was immediately wrong. I had tried to urinate and nothing was coming out, just a little bit. My stream had been cut in half. Now I had noticed something a couple weeks leading up to this. I had noticed that the strength of my stream was kind of weak. Sometimes it'd kind of spray. By the way, I should have warned you guys, this is going to be a very detailed video with some bodily function type discussion. So I had noticed that my stream had been kind of becoming weak. I wasn't really sure what to think of it. It didn't hurt or anything, and I was still able to use the restroom fine. But on this trip, at this one point of the trip, I had tried to use the restroom and it wasn't working. And then, so I realized, well, maybe I, have a bowel movement. So I tried to have a bowel movement, and everything came out like just a little bit, but it was like a string, like a shoestring, very thin stools. And when I would try to bear down and force it out, I experienced excruciating sharp rectal pain like I had never felt in my life. So at this point, I knew something was wrong. And as I went to go back in the car, I was sweating and just really uncomfortable. I told the wife, I was like, I need you to take over and drive. I laid in the back seat in the fetal position for the next hour or so while she drove back, just wondering what was going on, like thinking the worst. I am a worst case thinker. And I was just thinking that, it's cancer. And so, I kind of just laid low. I rested for the next couple of days and the symptoms did get a little bit better. I still noticed that I had difficulty starting a urine stream. I had difficulty emptying my bladder, and I had this constant fullness in the rectum. I wasn't able to empty my bowels properly. And so this was challenging, but I wasn't in tremendous amounts of pain like I was on that trip. The symptoms had kind of calmed down. So over the next 2 or 3 months, I had experienced these symptoms up and down. I actually went to the doctor about 2 weeks after the trip, and he's like, well, let's check for prostatitis. So I had some labs run. He did a prostate exam, and he's like, yeah, there's a little bit of inflammation in there. Not too sure. Your labs came back fine, but as a precaution, let's go ahead and let's get you put on some antibiotics. So I got put on an antibiotic, and I also got Flomax, which did help with the urine stream, but didn't really help with the symptoms, the rectal fullness symptoms that I was dealing with. So I was on the antibiotics. I finished off the antibiotics. I stopped taking the Flomax because honestly, it made me kind of feel weird and spacey in the head, and I didn't like how that made me feel. So I just kind of managed. I would avoid sitting as much as possible over the next couple of months. And then one day I just had a terrible, terrible flare up. Like all of the symptoms were back. I didn't know why they had cropped up again, but they were really, really bad. So I go back to my doctor, and he suggested that I possibly had a syndrome called Levator Ani syndrome. Levator Ani syndrome. So if you look at your pubic area, you've got the rectum and then you've got the genitals. And so you can kind of imagine those two areas and then a figure 8. And so the Levator Ani, and I'll probably throw up a diagram here, but the Levator Ani is basically this almost figure 8 of the bottom part of the pelvic bowl. And so the Levator Ani is like a secondary sphincter for the rectum, the bottom part, and it basically is a secondary group of muscles that can clench down, and basically it's what prevents you from using the restroom while you sleep. And so the Levator Ani muscles were hypertonic, and he said that the prostatitis type symptoms I had, between Levator Ani syndrome and what he described as chronic non-bacterial prostatitis, where there's some unknown inflammation in the prostate. They don't know what causes it, and a lot of guys deal with it. And so, first thing I do is I start searching Google. Doctor didn't really give me a lot of answers. So I start searching Google, and I find out that this is a dreadful condition, that folks who have it have been dealing with rectal pain, prostate pain, difficulty going number 1 and number 2 for decades. And I was terrified. So I turned to YouTube to see, well, maybe there's some content creators out there who have dealt with this. And sure enough, I find several male channels dedicated to pelvic floor stuff. But what I found in each of those were basically stretching. I didn't realize this at the time, but stretching as a hypermobile person doesn't help much. In fact, all of the videos that I watched that had a stretching protocol, every time I would do them, it would actually flare up my symptoms like nothing else. And so I felt like the only avenue that I had for getting well was bad advice that was actually making my symptoms worse. So I go back to the doctor and I was like, look, maybe there's something else going on. Let's get some scans done. So he gets me some x-rays and some MRIs, which were negative. And so he then says, look, I can refer you to a urologist and a proctologist. You're going to need to go to both. But he encouraged me. He's like, look, Keith, you'd be kind of wasting your time and money on these tests if this is all related to, pelvic floor dysfunction, Levator Ani syndrome, and chronic non-bacterial prostatitis. So he suggested that I reach out to a pelvic floor physical therapist, and he gave me a referral. And he also put me on prednisone for steroids to help with the pain and the inflammation, and also gabapentin. So I'm taking the steroids, I'm taking the gabapentin, and I reach out to a pelvic floor physical therapist. Now, mind you, I couldn't sit. So for we're going on 6 to 8 months here. I was at a place in my life where sitting caused an excruciating amount of pain, and it flared my symptoms really bad. And that flare would last for hours or days. And I was in anywhere from between a 4 and a 7 or even 8 out of 10. And so I contact a pelvic floor physical therapist who, by the way, they are not cheap. They are not cheap. They're very expensive. I think I was paying close to $300. And mind you, because I couldn't sit, traveling was quite difficult. Anytime I had to go to the doctor, basically my wife would have to drive me and I'd have to load up in the back of the SUV, laying sideways in a bunch of pillows. I couldn't lay on my back because it would put pressure on my sacrum and cause my symptoms. And I couldn't lay on my stomach because it would hurt my neck. And so my only option was to lay propped up with a bunch of pillows in the back of the SUV. Absolute nightmare. And so the pelvic floor physical therapist was like some 58 miles away, over an hour's drive, and I didn't know what to do. And so I had talked to them, and they had says, well, we do remote consults. We can come out to you. It'll be a little bit extra. So I was paying well over $300 for a pelvic floor physical therapist to come to my house twice a week, and I just couldn't afford that. But I did do about 5 or 6 sessions. And so she came over and she did some exam, mostly internal work. There was some stretching involved, although she quickly learned that stretching was not helpful for me. She also did some external work. Specifically, she examined my psoas and just did a little bit of gentle myofascial release on the psoas. She mentioned that they were very tight. Now, I didn't understand the implications of my tight psoas at this point. More on that in a minute. And then she also taught me how to do my own internal work, and I purchased a wand and learned from her how to do my own internal myofascial release of the internal muscles of the rectum. Unfortunately, us guys, we only have one option for that. The ladies have 2, and so it's a lot more difficult to reach the areas that may need to be reached doing internal work for guys, but that just kind of comes with territory. The ladies have childbirth to deal with, so we'll take what we get. So over the next 4 weeks, I still had symptoms. The things that she was giving me to do weren't really working. Sometimes the internal work would help take the pain level down, but then it would cause different pain and soreness, and then the next day would be even worse. So it was like a juggling act. Like, what can I do to relieve my symptoms? What's not going to cause me a flare the next day? And I was just getting worse and worse and worse. So finally, I reached out to her and I says, look, I'm at the end of my rope. I'm in terrible, terrible pain. My quality of life is gone. I'm dealing with really dark thoughts, thinking about, honestly, doing things that I shouldn't be doing, like ending things, if you know what I mean. I want to be careful with the YouTube algorithms here, but, and I was in a very dark place and I had no hope. I was broken inside and out. And she told me that at this point, she couldn't help me, that I was out of her scope. And so she referred me to another organization they work with called Pelvic Rehabilitative Medicine in Dallas. It's actually a national company, and they have multiple offices in multiple large cities. And their location in Dallas specializes in more interventional medicine to help alleviate symptoms such as injections and surgery. So the doctor of physical therapy that I saw there, ONT, She said, yeah, your symptoms are pretty severe. She did an internal exam, says things are very tight. Your Levator Ani is like a rock. And so she says, look, we got some new therapies that may help you with this. They're injections. And so what we do is we go in, it's called a Hydrodissection and a pudendal nerve block. And so they go in with a very long needle, under fluoroscopy. And it's like a motion picture X-ray. It's guided by X-ray, and they go in with this long needle and they inject some fluid and an irritant solution next to the pudendal nerve to kind of create space. And the idea is to take the compression off the nerve, which is why it's called a hydrodissection. And then a pudendal nerve block into the pudendal nerve branch, which involves a massive amount of steroids. Mind you, I was still on the oral steroids from my doctor, plus the gabapentin. And these procedures aren't cheap. It's like $600 for the 2 injections, and then you have to get that round of 2 injections 4 to 6 times. And so the whole thing can cost $5 to $6 grand. So I signed up and I got the first round of injections in the same day. And those injections, it was a pretty painless procedure. It was awkward, but it was pretty painless. And a lot of people reported improvement from this procedure, and they swore by it. And so I was game for it. So I got the procedure. And then the next day, something just terrible happened. My immune system did not like the steroids, the combination of the steroids that I was on or something, but I was nauseous and I had 103 fever for 7 to 10 days. And by day 10, my wife is finally like, you need to go to the ER. So we go to the ER. The ER looks at me. They didn't know what to do. It was one of those pop-up ERs, and they ran a couple of tests and ran some x-rays, and they're like, you probably have a cold. And so they sent me back home. Well, the next day my fever gets worse. And I've never had a fever for more than 2 or 3 days in my life. Something had changed with my immune system. My bowels were white, which suggested, pancreas or liver failure, or something. Something was going on where my organs were not working properly. And so I went back to the ER, and they gave me some additional medication. They couldn't find out what was wrong, but they says, let's keep monitoring it. So 2 ER visits, and nobody knew what was going on. And magically by the 8th or 9th day after the ER, my symptoms had subsided, and my immune system was kind of kicking back in, and things were working as normal. But I knew at that point that injection therapy was just not going to work for me. So I contacted my regular doctor, and he says, look, I think at this point we need to consider, maybe sending you to a surgeon. Maybe a surgeon can help. So he referred me to a Texas Pain Management Surgery Center, where the doctor basically quickly brushed me off. Told me I was manic. Well, yeah, I was manic because I was in a lot of pain, and nothing was working. And every time I tried to get treatment, things would get worse. And so I was quite nervous going in there. I was all over the place. And he says, look, your 2 options are ganglion impar block, which is a thick needle that is inserted into your spine, between the rudimentary discs at S1, between S1 and S3, which is basically your sacrum. And so they drill through your sacrum, and they try to hit the ganglion impar, which is a group of nerves that exits the sacrum and then goes and supplies nerve supply to your genitourinary branches, basically all of the nerves in your bowels and genitals that supply information from the brain to the pelvis and back. That sounded terrifying, but quickly he says, look, you're probably not a great candidate for it because it does involve that same massive dose of steroids, and if you've already had a reaction, then that's probably not a good idea for you to get. So the next option for you, Keith, is a nerve stimulator implanted into your sacrum, and it's a permanent installation. It'll last about 10 years, permanent, right? And basically it attaches onto the nerves and it sends signals to block out the pain. That did not sound like something that I would want to get. But at this point, like I mentioned in my first video, I was pretty desperate and I was willing to consider it. So I wanted some time. I scheduled it for like 3 weeks in advance, and I just wanted to think about it. So as I go home and I think about it now, meanwhile, something I left out, which I should have mentioned earlier, is that this whole time, my wife, who is a licensed massage therapist, and she works in a sports medicine type injury clinic in North Dallas, she'd been telling me the whole time that I need to go see her boss. Her boss is a functional movement expert slash chiropractor. He started off working for a clinic called Erasti, which is a chiropractic clinic that doesn't do manipulation or adjustments. They don't crack your back, but they do like physical therapy rehab. Their focus is on functional movement, the science of functional movement, which for those of you who don't know, this is a very important element in the heart of this channel, and that is functional movement therapy. Functional movement therapy basically focuses on addressing movement patterns and overall body mechanics to help enhance performance, prevent injury. Basically, it assesses your musculoskeletal imbalances, weaknesses, and inefficiencies in movement. You've heard of nature versus nurture. Well, functional movement is the nurture part. We get into bad habits by how we sit, how we walk, how we sleep, how we carry things, and how we do certain things in life. And sometimes these poor mechanics can create imbalances in our muscles, which can lead to injury and pain, and especially if you're hypermobile. So she'd been telling me this whole time, you need to go see Dr. Bo. You need to go see my boss. He can probably help you. And I'm thinking to myself, what is a chiropractor going to do? I don't need my back popped. I need my nerves fixed. And she says, I'm telling you, just go see him. So finally, I acquiesce and I make an appointment with Dr. Bo. She throws me in the back of the SUV and we hightail it over there for the next available appointment. And I tell you what, I never would have expected the results that I got from having a better understanding of my musculoskeletal system. So, I meet Dr. Bo and he starts with an assessment. They have these cameras there and software called KinetiSense, and they have you go through a set of things like, bending over and reaching up and jumping and squatting if you're able to. And I was barely able to do some of the moves just because I was in so much pain. But this software looks at you through the camera and it kind of makes a little stick figure on your body. And it analyzes how your joints move, how your gait is. There was a walking test. There was a single leg stand test. So there was a bunch of different mechanical tests that I had to go through where it assessed, where I might have some imbalances or deficiencies. And the software quickly picked up on a few things, that I had a weak posterior chain, I had a weak core, and I wasn't engaging my core when I was making movements. And so Bo then does a physical exam on me, does some basic muscle testing, which, kind of corroborates what the KinetiSense found. And he says, Keith, look, you've got a very weak posterior chain. You've got a weak core. Your glutes aren't firing when you are making movements. Your core isn't firing when you're making movements. This is putting a tremendous amount of pressure on your back, and your pelvic muscles are compensating. He says your psoas, so he pressed into my psoas and my hip flexors, my iliacus, and they were like rocks. In fact, it was difficult for me to fully stand erect because the psoas would like prevent me from standing fully erect because they were so tight. And so his theory was this, that the nerves that supply sensation to my genitals, my bowels, were being compressed somewhere in the pelvis. And he suspects that the tight psoas, which the nerves do innervate through, might be the cause, or it could be pulling on something else. But he suspected that my tight psoas muscles was a compensation as a result of my poor core and glute stability. And he says, Keith, look, your history of being sedentary, along with your history of sitting so much, has led to your psoas becoming chronically short and chronically tight. And basically the psoas was picking up the slack that my core and glutes weren't doing in supporting the upper half of my body. And that because the psoas was tight, my nerves were being compressed, and in response to this, my brain was sending signals to make my pelvis go into lockdown, as we talked about in the last video. Hypertonicity, pelvic hypertonicity. When something isn't working right in the musculoskeletal system of balance, your pelvic muscles will sometimes pick up the slack, and that's causing the compression. So, how do we fix all this? How do we get from a rock hard pelvis, a weak flabby core, and glutes that aren't working or activating? How do we get from that to a system of balance? Well, he employed a treatment strategy. So he says, look, step one is you have to learn how to engage your core and engage your glutes. And so he gave me specific exercises for that. He also said you need to learn to relax your pelvic floor while you're doing these core engagement and glute engagement exercises. I'm going to go into a lot more detail in another video on all of these things that I'm listing here, but I'll explain this one briefly. Basically, I had to engage my core, engage my glutes, and also drop my pelvic floor, which is called a reverse Kegel. Again, I'll have an instructional video on these things at another time, but doing three things at once, like if you can't walk and chew gum at the same time, it's very difficult, especially if your pelvis is hypertonic and everything's on lockdown. It's very, very hard to wait, I have to brace my core and fire up my glutes and drop my pelvis at the same time. It was quite challenging to learn this technique. But I did learn it. And once I learned it, it was like something had unlocked and I was able to sense the tension in my pelvis throughout the day and then take preventative steps or active steps to reduce the hypertonicity throughout the day. And this was a very key instrumental part of my recovery, is doing these three things at once. The next thing was, corrective exercises to strengthen the core and strengthen the glutes. This was a very slow approach he took to this. And while my therapy was long and multiple times a day, he slowly brought me into corrective exercises. You don't want to go, while I will stand on this pulpit and preach all day that a lot of folks' pelvic floor dysfunction is caused by weak core and weak glutes. The solution to pelvic floor dysfunction isn't just to rush into, you don't want to just go doing 1,000 sit-ups. You don't want to do that. You're going to make your situation far, far worse. You have to go gradually and slowly. The first part is engagement. You have to learn how to properly engage things. Then you work on building strength. Once you learn how to engage and then relax, then you start to build strength. And you've got to go slowly and not go into it too crazy. There was also rehabilitation, which was basically myofascial release. Myofascial release, for those who aren't familiar with that word, is basically deep tissue work. You're working, you're using either a hand, a finger, a fist, a tool, a foam roller. You're basically asserting pressure throughout the length of the muscle and into the attachments of the muscle and the ligaments and the tendons to help break up some of that scar tissue, lengthen the tissue itself, and promote circulation and eventually healing. And you're telling the body, hey, it's okay to relax this. You're kind of beating the body into submission. A disclaimer, you don't want to go into self-myofascial release without the guidance of a licensed physical therapist or doctor. You need to understand how much pressure to apply, where to apply it, where not to apply it. You don't want to go aggravating a nerve or kind of causing some damage. You can go in too hard and you can aggravate a nerve, and that will leave you with a new issue to solve that could take 4, 6, 8, 12 weeks or longer. And I've talked to a couple guys who went in there too crazy and they started doing things they shouldn't be doing, and now they have some longer lasting symptoms to recover from, in addition to their pelvic floor dysfunction. So again, be careful with that. He also gave me breath work. He explained to me that the fight or flight part of our autonomic nervous system. The autonomic nervous system is basically what it sounds like. It's like the automatic response to pain, trauma, or other stimulus. And there's two different types, which I'll get into in another video. But there's two different types of autonomic responses. You've got the sympathetic response. It sounds nice, sympathy, right? No, the sympathetic response is your fight or flight. It's what makes you just go on lockdown internally. It's like you realize you're about to get hit by a car. It's like the adrenaline kicks in and everything gets solid and rigid. And then you have the parasympathetic response. The parasympathetic response is what happens when we get good news. Like, let's say there was a debt that you couldn't pay, and then all of a sudden you got a bonus at work and you're like, and everything relaxes. the good news is sunk in, and you realize that the problem isn't a problem anymore. And so I had to learn how to do breathing exercises and meditative type of exercises to calm my central nervous system down, to assure myself that things were going to be okay. And this is a powerful tool in managing pelvic floor dysfunction. I'm not into the mumbo jumbo hocus pocus of like meditation type stuff, but doing breath work and focusing on relaxation was very instrumental in helping me address my heightened autonomic nervous system response, which was responsible for a lot of my pain. And then in addition to that, I continued to do some internal work during flares, which I did find helpful. You know, at first I when I went to see Dr. Bo, I was very quick to kind of write off the doctors because they prescribed me medication that just messed me up in the head and messed with my immune system. I was quick to write off my pelvic floor physical therapist and the YouTube videos that were just stretching only. And, you know, all of those things had their merit and had their value. And in fact, one of the other things with the myofascial was he did want me doing a specific type of stretch to lengthen my psoas. That is the only stretch that worked for me, and it's the only one that I needed. And so every body is going to be different. You'll hear me say that a lot. And you're going to have to find out what you need. What does your body need? And one of the things that I'll talk about in the future is being in tune with your body and understanding you know, what feels good. What feels good is generally a sign that your body's like, I need that. This is tight. Stretch this. It feels better when you do this. It feels better when you strengthen this. It feels better when you engage this. And so we have to learn to be in tune with our bodies. But I digress. I was saying that I was quick to write off all of the other modalities that I had tried. And I found that each one had its own inherent value. The steroids were a helpful tool. You don't want to be on steroids for a long time. It's bad for your immune system, bad for your life, bad for your bones. It dries you out. It can cause other problems down the road. Even the doctors will tell you, don't stay on the steroids too long because it's known to do that. The gabapentin was actually, it was helpful. I was at the max dose for over 8 months, and coming off of it was terrible. And so I wouldn't recommend it to my worst enemy, but I will admit that it was helpful in reducing my pain, my neuropathic pain, by about 30%. And so the pelvic floor physical therapy, the rectal internal work was somewhat helpful sometimes, and I had learned how to make it helpful for me. And I've got a whole video on internal work that I'll be working on here in the next month. And don't worry, it won't be visual, but it'll describe kind of the process and going into it and what to do and what not to do, because there isn't that much of that type of content on YouTube out there. And again, my disclaimer, I'm not a licensed medical professional. I'm not a physical therapist. The only license I have is my driver's license. And so, but I'll be talking about what I did. And so the exercises I incorporated from Dr. Bo, the myofascial work, the internal work. I was still taking the medication, or at least the gabapentin, when I was going through the initial parts of my therapy. I learned something immediately from seeing Dr. Bo, was that, you know, when he performed myofascial release on my psoas, I had a remarkable reduction in pain in the moment while he was doing it. Maybe shortly thereafter, I felt a little bit better. Not much, but 20%. And that's the first time I felt real relief from doing anything outside of popping a pill. The second thing I noticed is that over the next week or two, as I did the prescribed rehab at home, which was 4 times a day, 20 minutes each time. Talk about commitment. But I was motivated because I had to get out of pain. I had to get my quality of life back. I'm a father of 3 children. I work 2 jobs, and I absolutely had to get back to a quality of life where I could work and function as a father, as a husband, as a provider. And so I was committed. I was committed to getting it done. And so, but I noticed that when I would perform certain exercises, specifically engaging my core and engaging my glutes, I would feel a sense of like my body was like, this is good. This is helping. And so again, it was like a very, very minuscule reduction in pain while doing it only. And so I actually messaged Dr. Bo and I was like, hey, I'm experiencing a reduction in symptoms. Should I just be engaging my core and engaging my glutes all day long? And he's like, yes, like 20% engagement, 10 to 20% engagement. That's a sign that your body's saying this is helping. And so I felt within just 2 weeks, I felt a slight reduction in symptoms, and I finally had hope. I finally had hope that I wasn't going to be stuck there forever. And I just want to share that with you guys. You can have hope too. And I hope that you find what works for you, but I'm going to share all the knowledge I have in my channel. And you can hopefully apply those principles for yourself. But, so that's my story. That's my story. I did forget to cover a list of all of my symptoms. And I'd like to go over these just so that you guys watching know exactly what I was dealing with. And in case some of these check off for you, it might be a sign that you have pelvic floor dysfunction. Again, talk to your doctor about these symptoms. You do want to get the big stuff ruled out. You want to make sure you get blood work done. You want to make sure you get some scans done just to rule out the C word, just to rule out something more significant, something, going on that needs more immediate medical attention. But here is the list of my symptoms. So urinary symptoms, as I mentioned, weak stream, split stream, inability to empty my bladder fully, constant urgency. At some points, I was peeing up to 30 times a day. My PFPT had me write down, keep a little journal, a little bathroom journal on how many times I was using the restroom. I had this ureter burning, bladder pain. I would get post-urination burning, post-urination dribble, like I'm talking tablespoons, upwards of like an hour after I would use the restroom. If I wasn't already running back, like it would just leak. Like, why is it coming out? And what it felt like was that there was some urine trapped somewhere in the ureter, likely behind some sort of constriction. And then bowel pain and rectal pain. So I had thin stools, incomplete evacuation. It was like there was always some more there that wasn't coming out. It drove me mad. And that, of course, would cause me to strain, trying to get it out, which would, of course, cause that sharp pain. And then I'd have a massive flare after any time straining, even just a little bit of straining on the restroom. So it was like I just had to deal with this constant fullness. Even after emptying, even after using the restroom, after drinking a couple cups of coffee in the morning and having my normal routine, there was still more that wouldn't come out. I had trapped gas. I had difficulty releasing gas. And it was very difficult to get gas out. So I was constantly feeling bloated. I had that full swollen prostate, which was the worst sensation out of all of them. And it was different than the rectal fullness, although they were kind of mixed and there'd be overlap, but this constant, like I was sitting on a softball, even when I wasn't sitting. It was a little bit higher up, kind of just up above the perineum where the prostate sits. I did have some not necessarily coccyx pain, tailbone pain, but I would have tightness at the attachments to the tailbone, like the muscles that attach to the coccyx and the sacrum, around S2 and S3, like all of the, if you look at the anatomy chart, try to put one up, all of the attachments right there were very sore and tender to the touch. So that was urine and bowel. Let's talk about the man parts. I had 50% or more numbness of my man part. And I want to be careful with the words that I use because of YouTube algorithms. I want this video to be accessible for many people and not shut down or flagged or something like that. I had 70% loss of quality of my erection. I had an hourglass shape, constriction to my man part. I've never seen anything like that before. I didn't know what it was. I would later learn that that's a classic telltale symptom of hard flaccid. I would have this feeling like my man part wasn't there, like it was detached. Like it was, in addition to the numbness, it was almost like a dissociation of the nervous system where it wasn't part of me anymore. It was cold and non-existent. There was like this buzzing sometimes, like static sensation, like zzz, like going on in the glands. I would sometimes have a very vague ache to my testicles. I noticed that the physiology was changing. In addition to the hourglass shape, my pubic prominence, you'll have to look that one up, was kind of sunken. Like everything was shifting. Like it looked different. It did not look like it used to just, months earlier. I would have 80% loss of pleasure during orgasm. The contractions were just non-existent. Sometimes nothing would come out. That's called retrograde ejaculation. I would have sharp pain during ejaculation. I would have like this dull pain afterwards. Again, with the post drool or dribble, it would continue to come out for a long period of time, sometimes hours. I also had some mild numbness to my perineum. And, I think that's called saddle syndrome. But basically those are all of the symptoms that I dealt with. So if those check boxes for you, talk to your doctor about that. And so basically that's the end of the video. I didn't want to go too long here. We're already at 40 minutes. But I do want to mention a couple of things. As a YouTube consumer, I have to admit, I really dislike the please consider liking and subscribing and commenting at the end of this video. But now as a content creator, I really understand the value in that. Let's face it, it's how the algorithms work. So if you would please consider liking, subscribing, and commenting, even sharing the video with someone that you talk to online if you found this information helpful. Check out the channel info section. I've got a link to my blog, which I try to write one article a week on some of the methods here if you're a reader or you like to kind of refer back to things in writing. We also have a Discord channel. We've got about 40 members. I'm not sure how many members we can handle, but I want to open it up to anyone who wants to talk to others about their symptoms and have just a little bit of dialogue about, what you're experiencing versus what someone else is experiencing. Share stories, share victories. We already have a couple of folks who I've been working with who have seen improvement, almost complete improvement in some cases. And so I want to encourage you, again, there is hope for pelvic floor dysfunction. There's hope for you guys. And also finally, if you're interested in supporting this type of work, it's not cheap to maintain, Adobe Illustrator and Canva and some of the other tools that I use to help produce this content. So if you're so inclined, no obligation, please consider supporting me on Patreon. Links in the channel description. Love you guys. Appreciate you. And I'll see you in the next one.